Dr. Couto, you have a patient that comes in, went to another plastic surgeon because you would never have any problems with your breast augmentation, but they went to another plastic surgeon, clearly a little bit of a misjudgment, or just a young plastic surgeon that was trying to please that patient, maybe went a little too big with the implant and lost the support for it. What kind of complications have you seen?
Yeah, there are several. One, the most common, like you mentioned, implant malposition. Second will be bottoming out, which is like stretching of the inferior lower pole of the breast. Those are the two most common you will see from a large implant on a patient. Why that happens? Because there's no support for the implant. The skin is being stretched and the implant leads to an inferior position. So one thing that I found actually very helpful is using three-dimensional imaging like Vectra is a good way to educate the patient where you can understand her needs, but at the same time make her understand what are the challenges. And I think Vectra, like three-dimensional imaging, plays an important role so that the patient can visualize what are the obstacles with this operation.
A patient comes in and clearly they pick out an implant that is, or size that is way too big for the body. How do you talk to them about that?
Well, unfortunately, it's about their aesthetic, not yours. So that is a very hard conversation to try to convince them that they actually want something smaller than they actually do. So in some ways, you have to accommodate the patient's goals. But as you've pointed out, all things being equal, the bigger the implant, the more chance of causing a problem, the more chance of it moving out of position. So you have to walk a fine line. But there are a subset of women who just want an implant that's going to exceed their base dimensions, and it's going to lead to potential problems.
Right.
But I think that it doesn't really make sense to prophylax against a problem, for example, with acellular dermal matrix or Galaflex until you have a problem, because even with those large implants, your chance of having a problem is still fairly low. So treat the problem when it happens, not before it happens.
A great discussion. I'd like to thank you, Dr. Restifo and Dr. Couto, for a fantastic discussion about this.